Hi, I'm Dr. Anitra Warrior with Morningstar Counseling, and in this video we're going to talk about the differences between childhood trauma versus adult trauma. Something that's really important for all of us to understand when we're talking about childhood trauma is the brain development that we see with our children, and recognizing that the executive functioning of that portion of our brain, our frontal lobes, doesn't fully develop until we're in our 20s. This is important for parents and teachers to recognize when they're working with a child or raising a child who has experienced trauma, because that leads us to misinterpret the behaviors that we see. That leads us to misinterpret the emotions that children experience, because we're thinking they have adult brains in child bodies, and they don't. Their brains have not been fully developed. So things that they experience that might not seem as severe to us can be very severe to them based on their level of brain development. One of the things that we found to be extremely effective in helping parents, teachers, and even children themselves understand trauma is using a book that we have here. And this is called Trauma, Teaching Kids All About Trauma. This is a very effective book that goes through various types of trauma, including weather-related trauma, moving, death, abuse. There are so many examples. And what we've been able to see is that when we touch on an area, or when we get to an area that a child has experienced, we can see a change in their body. We can see them moving differently. We can see them being a bit more quiet. Maybe they disengage, or maybe we start to see disruptive behaviors. Those are indicators to us that this particular subject is pretty heavy for them. So we do find this book very effective in the work that we do in helping children feel comfortable about talking about trauma or what they've experienced. The other piece that I think is really important for parents, children, and teachers to understand about trauma is that, again, going back to brain development, they may not be ready to talk about it. When they do talk about it, they may describe it in a way that doesn't really make sense. They may not use terms that are anatomically correct. This is important for us to interpret and to support in developing that language. So for example, it can be really helpful to talk with a child about the parts of their body, reminding them that this is their body, only they have permission to touch their body. They are the ones who give others permission to touch their body. And using the right type of language is developmentally appropriate in helping them take care of themselves, as well as keep you informed in regards to safety. When we're looking at symptoms of trauma, this can be a wide range of things that we might see. Unfortunately, these behaviors, these emotional things that we see with our children can sometimes be misdiagnosed. So it's very important to work with a provider who is familiar with trauma, to talk with the teachers and other adults that are in the child's life to understand the impacts of trauma. One example that I can give that has been a really difficult area for us in working with children across the state of Nebraska has been the level of misdiagnoses that we've seen. So when we're talking about PTSD, post-traumatic stress disorder, I think it's important for people to recognize that this is really an injury. This is an injury to our hearts, to our minds, to our emotional well-being, and should be treated as such. When we have that injury, we may see things like the emotional dysregulation, to where I may come into school one day and I'm happy, and in the afternoon, I may hear something that has me completely off the charts for the remainder of the afternoon. I may be overly sensitive and want to be verbally or physically aggressive. It may be hard to learn in school, pay attention, to focus. I may need to get up and move around. And these things can be misdiagnosed as ADHD. In addition to being diagnosed as attention deficit hyperactivity disorder, it can also include things like oppositional defiant disorder. And what we're doing is looking at it as more of a punitive response rather than understanding the trauma and the impact that that has. So it's important for us, again, to pay attention to these behaviors, get an accurate recount of the history so we know what's taken place for them, to see what do we need to be focusing on, trauma, or is this actually a behavioral disorder? To go a little bit further with the symptoms that we might see, there can be words that may be considered triggers. And I know triggers that word alone can be really severe. And I think it's important to use that word, though, because of the severity that's behind trauma. So when we talk about triggers, we could have something like ketchup, that spilled ketchup might look like blood. And that's going to be a trigger to a child. A certain touch, a certain smell, anything that's going to be related to our senses that happened at that event, if they were to re-experience that again, that can start the dysregulation. That can be the cue for self-preservation, which may mean I'm going to respond with anger, I'm going to respond with disengagement. And in the video from Trauma 101 that's part of this series, you'll learn more about trauma and the fight, flight, freeze that we all experience that's part of our brain. And for children, it's going to be more behavior, because behavior is language for children. Psychoeducation for trauma is vital when you're working with students of any age. This also applies to adults. And one of the areas that we focus on as providers in the work that we do is looking at the window of tolerance. What that is teaching us is we all have a window of stress that we can handle, and our body responds in terms of the fight, flight, freeze. What can happen to us is we can experience a traumatic event and not go through appropriate processing for healing. What this means is talking through it, recognizing that we are safe, or being able to develop appropriate coping skills to help us. And what can happen is we can move into that state of dysregulation where we're looking at maybe hyperarousal, which you'll see on the top of the screen in this graphic. With hyperarousal, what you're going to see is more of the anger that people are responding with. This can be especially important when we're talking about children, because it's anger towards adults, it's anger towards children, it can be anger towards themselves. And again, this can be verbal or physical aggression that we might see. And then if you look at the bottom of the screen, we have hypoarousal, which is going to be more of that retreating to where we might see more of the anxiety or even more of the depression that's happening for children. And what we want to be able to do is help them develop skills to pull them back into that window of tolerance and actually make that window of tolerance much larger with the skills that they've learned. Another area that's important for us to think about with children and their understanding of trauma is how they internalize this. What can happen is they will develop unhelpful thinking styles. They will think that the trauma was their fault. What they had experienced was because of something they did. This also goes back to the brain development and where they are and how they're able to abstractly think about this was the other person's behavior. This was their actions, not mine. And I shouldn't be blamed for this. And with that, they also carry a great deal of shame. Other unhelpful thinking styles that children may develop would be overgeneralization, to where they may have an example may be, if I've had difficulty or I've experienced trauma from a particular male, I may start to think that all males that look like this individual are going to be harmful. Then it may generalize to all men are unsafe. And we start to adapt our worldview to where we can challenge or create these core beliefs that are set in place to protect ourselves, but they may be things that actually cause more harm, that keep us from being able to learn, to grow as individuals, but it's all in an effort to self-preserve. So it's very important to think about those unhelpful thinking styles that children and adults can actually experience as a result of trauma. With trauma that is experienced by children and adults, there are so many skills that we can develop for self-monitoring, ways that we can respond to care for ourselves. One of the tools that we use is what we call an emotional thermometer. With this thermometer, what we do is define what those temperatures will look like. So you can see there's the 10, 20, 30, all the way up to 100. When we're at 100, that's saying that we're at the highest point in that emotion. When we're at 0, that's saying, okay, there's really no emotion. What we want to be able to do, and what we help our children and adults do, is recognize that when my emotional temperature starts increasing, at what point do I need to use a coping skill? For some, it may be 30. I'm starting to get dysregulated. I notice that my body's getting tense. I notice that I'm getting angry right now. I need to step back. Maybe I take deep breaths. Maybe I do a sensory kit. And for others, it may be at 60 when I notice I'm starting to be a little bit more reactive. I'm starting to sweat. I'm feeling tension in my hands. And then we recommend different types of coping skills. So this is one that I think is very important for teachers to have in their classrooms, for parents to have in their cars, on their fridges. It's a very important skill for self-awareness. So in closing, for anyone who is raising children, working with children, and you may suspect that they've been exposed to trauma, the big takeaway that I would want you to have from this particular video is remembering the importance of brain development and knowing where children are in terms of how they may interpret things and how they respond. It is going to be different because of their brain development and their executive functioning still in the process of growing. The other piece is remembering that behavior is language. So they may not have the right words to say, you know what, I had a rough day. Instead, they may act it out. That's so important for us to keep in mind. And lastly, and most importantly, what I would want to stress is that help is available. There are qualified professionals all throughout the country, in the state of Nebraska, all throughout, that are able to provide support to you, your family, your children, as well as your colleagues, your teachers, daycare providers. There's quality service that is available for all of our children to be happy, healthy, and thriving. Thank you.